We are learning of two new measles cases as the province confirms more cases this year than all of last year. This is a live shot from Pearson Airport this hour, where we're looking at an exposure. Hamilton Public Health is warning travelers may have been exposed to the virus in Terminal 3 of Pearson Airport on March 5th. If you travel through Pearson or Terminal 1, nothing to worry about. But again, this is for people who traveled through Terminal 3. The agency says those who flew on a Saudi Arabian Airlines plane that landed at the airport around 3:30 that afternoon may have also been exposed. It says the child became infected during a trip to India and is recovering at home. Meanwhile, north of Toronto, the Simcoe-Muskoka District Health Unit has confirmed its first case of measles and believes others may have been exposed. Officials say the person was immunized and had not traveled recently or been in contact with a known case. They have published a list of locations in Cookstown, Alliston, Thornton, Angus, and Collingwood that the patient visited between March 4th and March 8th. And for more on this, we're joined live now by Dr. Fahad Razak. He is an internist at St. Michael's Hospital. Dr. Razak, thanks so much for joining us. Let's begin with the case out of Pearson. It's March break. There's been a lot of travel there, a lot of families going through the airport. Are you concerned about exposure at a busy airport like Pearson?
Yeah, unfortunately, it is a source of concern. Like, if you think about Canada and Ontario specifically, we are one of the most well-traveled high-income societies in the world. So it's not unusual on a typical year that you'll have occasional cases coming in for someone who's traveled. The difference, however, right now is that our immunization rates are much lower than they need to be, much lower than they were in the last few years. And so that creates a population of people who are now susceptible to that exposure. And that's the critical risk that this is introducing. This is the situation we're in. And if you want to see what the worst case scenario of this can look like, we can just look across the ocean at Europe, where from 2022 to 2023, they had a more than 50-fold increase in the rates of measles cases, from under 1,000 cases in 2022 to over 50,000 cases in 2023. That's because they, like us, have had a drop in immunization rates, and this is the big problem.
And that is a dramatic rise in cases. Are you worried about that happening here at home? Are you worried about community transmission and local outbreaks?
Unfortunately, yes. And again, this is a situation that we have not had to worry about in Canada for many, many years. Look, I've been in practice for more than 15 years. I've never seen a case of measles because in Canada, since 1998, we've had a break in the transmission of measles, essentially eliminating community spread in Canada because of vaccination rates. And now we're suddenly in a situation where many other providers like myself have to worry now about cases of measles coming in our patients because we've had this drop of vaccination rates. So this is really, I would say, an extremely unfortunate situation. It reflects the drop in immunizations, partially because of disruptions from the pandemic and the delivery of these vaccines to children when they should have been receiving their vaccines. Yeah. But it's very clearly also being driven by misinformation.
Yeah, you have just described a worrisome scenario in many other parts of the world. It does sound like, as a public health expert, you're watching this very closely and you're concerned. So from a public health standpoint, what more can be done? Should every single school be setting up vaccination clinics right now?
Look, I think the public health groups across the country and here in Ontario are working extremely hard on this. We are lucky to have extremely capable public health facilities and institutions and practitioners. The problem is that the catch-up process does take time. And so this is a situation now where people have to be vigilant. You have to keep an eye out for these symptoms. So the typical symptoms we talk about are after exposure. They tend to occur about 10 to 12 days. They start. The rash tends to kick in at about 14 days. It's the fever, the cough, the characteristic red rash. Unfortunately, if these kind of symptoms develop now, you have to be worried that it could be a case of measles, especially if you are under-vaccinated or unvaccinated, or if you are immunocompromised. And if this occurs, if you are otherwise managing, the first thing to do is contact your public health unit. Do not go right into a clinic and expose lots of other people. But of course, if you're feeling very unwell, you have to seek urgent medical attention. So we in the hospital side are now vigilant for this coming in as well.
Dr. Razak, then there's the issue of a rise in anti-vaccine sentiment post-COVID. A lot of doctors saying that's the reason why we're here in the first place. Is there a way for public health messaging to get to people before we begin to see local outbreaks? How do you tackle that?
Yeah, look, a critical problem. I now receive this kind of pushback from patients Every time we bring up the issue of vaccination, I'm ready now to hear from patients that they're worried about the vaccine. They don't want to get the vaccine. They've heard or they've read somewhere about the harms. Let's talk about the MMR vaccine, which is what specifically protects you against measles. This is a true scientific pinnacle of innovation. This has been around for many decades now. Prior to this vaccine, millions of people every year died of measles. For those who survived, many had permanent brain damage, loss of vision, loss of hearing, permanent suppression of their immune system. We have an ability to protect people nearly completely against these kinds of complications, against dying, against the long-term complications. This is a vaccine that's been given out billions of times. And so I cannot emphasize how safe and effective this vaccine is, that we have a very long track record studying it. If you haven't received this vaccine, please get it. If you want to talk to your healthcare providers, we're happy to talk to you about it.
Okay, Dr. Fahad Razak, internist at St. Michael's Hospital and former head of the Ontario Science Table. Thanks so much for your time. We appreciate this.
Good to be with you, Lena.